Dr. Kiel, how are you today?
I'm good. How are you, sir?
Wonderful, wonderful. Thanks again for coming out. We do appreciate that. What we wanted to talk about is your story. So, first of all, tell me, what is it that you have done, or what was your profession before before your incident here
I
in
was
cancer?
a family physician for 25, 30 years.
25, 30 years. Wow. And did you have hobbies as well that you did?
Sports related, hiking, and I actually selected old beer tan. So
Really?
I know a lot about Milwaukee.
We'll have to talk about that
Okay.
then, definitely, definitely later on. That's great. And how long ago then were you diagnosed?
I was diagnosed in October of 2009.
And you were diagnosed with?
It's called mucoepidermoid carcinoma of the accessory salivary glands at the base of the tongue.
Okay.
A very rare cancer.
Wow, wow. And what kind of treatment was given to you?
Originally, they talked about surgery. When I went to see the radiation physician, he suggested I go to Seattle and have neutron radiation as an alternative. It was the only, my kind of cancer was the only time that they used this particular form of treatment.
I see.
So in November and December of 2009, I went for 6 weeks up to Seattle, where I went through 16 rounds of this neutron radiation.
Wow, wow. And how did that affect your life?
I lost about 40 or 50 pounds.
Wow.
I was out of work until February or March of that year, but I did come back, and I was able to resume pretty much full-time duty by April or May until that following October when my cancer came back.
Wow. Wow. And then what happened? How was it treated at that point?
Well, at that point, when it came back, then Dr. Ducey, who had been my surgeon all along, who's highly regarded in this area, and down in Cleburne, where I live, south of Fort Worth, scheduled me for surgery December 8th of 2010, and I underwent removal of a portion of my tongue, pretty large portion of my tongue. I had to split the mandible and open it up, unhinge it, to be able to get to my tongue, since this thing was way down at the base of my tongue. And then they folded my tongue back. And then in the biopsy, or in the pathology of this thing, the cancer came back worse, in a worse grade, high grade instead of low grade like it had been initially. So in January through March of 2011, I had to undergo radiation again. And that's what pretty much did me in.
The radiation did.
And the unhinging of my jaw.
Wow.
I was left with this pretty severe trismus.
Wow, wow. So you're saying severe trismus. How large is your opening in your mouth, or how much
Well,
can you do that now?
you know, it progressed over the time. Right now I have 17 millimeters of opening. I've been through a year and a half with a Therabite, through various physical therapies. I'm going through a different form of physical therapy right now with acupuncture. But normal being, I think, 45 to 50, I'm at 15 to 17.
That's starting out before your therapies.
Well, that's where I am right now.
Oh, that's you are now. Okay.
Yeah, I think if I hadn't been through all my therapy, I might not have any openings.
Wow, wow.
Yeah.
And how has that affected your overall life?
Well, I can't eat. I haven't had anything to eat or drink, essentially, other than pudding now since December 8th of 2010. So I lost 40 pounds again.
Wow.
I still have a feeding tube that my wife manages, and besides the physical issues, there's a lot of social and mental issues too that go along with not being able to eat or drink.
Sure. And so, doctor, how did the Therabite help you out within your therapy?
During all of the healing process, and I also developed an infection in my jaw. I've been through countless things, and lots of antibiotics and lots of other therapies I haven't mentioned, but through all that healing process, it real good chance that my mouth might have gotten where it was not able to open at all, or that I could not swallow at all. And if that was the case, then they would have to go in and do a laryngectomy, where they essentially close off your larynx, leave you with an osteotomy, and I've been able to avoid that. I can still talk, although I'm a little limited from my swallow problems and also from the infection. But I can still open my mouth some, and I mainly can deal with my own secretions, and that's a blessing for me.
Understood. And so when you're saying that you had a number of secretions that were being produced, the therapy, including Therabite, helped you to control that?
Helped me to control that. I can at least swallow and get most of those. Some of them I have to go ahead and spit out, but a lot of it I can clear just like I'm talking to you. When I first had the surgery, I had to go everywhere. I had to spit everything into a cup.
Oh, wow.
I had to carry a cup everywhere I went, but now I can go pretty well with some form of conversation, but not having to sit there and drool in front of you.
Sure. And you're certainly, just seeing you here, you're absolutely controlling everything. How does that make you feel?
Well, it makes me feel better.
Good.
You know, I said a lot of this. Interesting enough, after a year and a half not eating food, it actually becomes something that's not so bad. But the isolation socially that comes along with not going out with your friends to eat, and they not wanting to eat in front of you, having to always spit in a cup, or wipe your mouth if you're out eating with them, or not being able to talk. There's a lot of social things that go along with this that are almost worse than the physical handicap.
Sure. And now because you're gaining confidence, that has helped.
It has helped.
In those.
It has helped. I do feel better about it. You know, I'm less depressed about kind of the scenario of life. Trying to get back out there and, you know, get busy being a grandfather like we talked about, and just try to live life again within the restraints that I have.
Sure.
I can only go about 4 or 5 hours before I run out of energy, since I can't eat or drink anything on the run. But anything that's a 4 to 5 hour time frame, I'm good.
That's great.
So I can do the ball game. I just can't stay for extra innings.
That's why they have DVRs, right?
That's right.
That's right. You can catch the extra innings that way.
Yes, sir.
Excellent, excellent. Well, doctor, is there? Are you practicing now?
No,
you're not practicing now.
Since I was unable to really put in a full day, and I spent on the average of 3 afternoons a week for the last year and a half here in Fort Worth, which is about 50 miles from where I live.
Okay.
Due to all the different therapies and radiation treatments and hyperbaric treatments and on and on and on, I just was.
It's just too much.
It was too much for me to continue to practice. So I do voluntary work in our clinic in Cleveland, but I don't practice full time anymore.
Okay. So you volunteer as a physician?
I do volunteer as a physician. I did that this morning.
Oh, you did?
It's
okay.
Fun, and just for patients in our county that need some help with medicine and medical care, and it's pretty rewarding.
That's excellent. That's excellent. Well, doctor, is there anything else that you'd like to add as far as your journey and how Therabite may have helped you?
Well, I think the Therabite helped me as far as maintaining my openings. For those months when I was going through all the infection, the radiation, I really wasn't having any physical therapy. And I believe that if I had not had the Therabite, that there's a distinct possibility that I would have ended up with no function of my mouth. It hasn't been a miracle, and it never was intended to, but it was a very convenient way for me to be able to work on keeping my mouth as open as I could whenever I wanted to, without having to go up here to see somebody or go somewhere to be done, since I was spending so much time traveling to all my other treatments. So that's what I'm thankful for Therabite, is that it helped me at least maintain a level of proficiency as far as trying to keep on going.
Got you, got you. Wonderful. Well, Doctor, thank you again so much for sharing your story and the time. We greatly appreciate it.
Sure.
And best of luck in the near future.
Thank
I'm
you.
sure everything will come your way.
I appreciate it. Thank
Great,
you
great,
for your
thank you.
time. Nice to meet you, sir.
Nice to meet you.
All right. Thank you.